Okay, good afternoon, everyone. We're just waiting for the participant list to finish populating. It's still going up, so we'll go ahead and get started. Appreciate everyone's patience. We were just ensuring that we had a quorum and gave people the opportunity, committee members the opportunity to log in before opening up the public program. All right, great. Well, our participant list is holding at 89, so I will take that as a sign to get moving. I'm going to attempt to share my screen. No, I'm a little far ahead. I'm going to scoot back. All right, so welcome everyone again to the third meeting of the Health Fund Advisory Committee. I'm pleased to be joined by my fellow committee members. We do have a quorum. There are some members who had RSVP'd that they will attend who are not yet present, but we're going to go ahead and get started in the interest of everyone's time. So going to begin with an approval of the minutes from October 22nd. Those have been distributed to committee members, but I will give everyone a moment to review and then entertain either a motion for approval or any changes prior to a motion for approval.
Madam Secretary, move we approved as published.
Second that.
Great. I have a second. Is there any discussion? Okay. All in favor?
Aye.
Anyone opposed? Okay, great. With that, the motion carries. So we today are going to move into a discussion of the funding scenarios. I know we have a lot of folks in attendance based on the conversation we had during the second meeting. I do hope that we have an additional scenario for everyone's consideration today that will hopefully alleviate a lot of the concerns and also support the recommendations and the discussion that the committee had around the long-term sustainability, not only of the tobacco fund, but the programs that are funded, that are currently funded with tobacco funds and that everyone hopes to see continue in the future. So I want to just quick walk back through, because I know, again, there was a lot of conversation last time around, are these cuts, who's funded? I think what I heard very clearly from the committee is that we want to ensure, or there's no judgment being made about whether these programs should continue or have value to the state. And so to that end, I said I would bring back some of the slides from the first meeting that talked about the specific health concerns that these funds and these programs address. So again, the main reason that we're all here is really to promote smoking cessation and to really support Delawareans to never start smoking or using tobacco products, and for those that are, to move them off of those products and get them on a healthier path. So again, we continue to see, while actual cigarette smoking of teens is down, they're using tobacco products and other products via electronic devices, so continues to be a key concern. Again, this was really addressed and continues to be proposed to be addressed through the Innovation Fund, and the programs that were put forward and funded through the Innovation Fund really get at some of these nuances and new ways that tobacco companies and tobacco products are being targeted towards youth and even adults. So again, we continue to be concerned, and prior to the Innovation Fund, really didn't have a way to get at or provide funding to teens and others to discourage electronic cigarettes and vaping and other ways that people are using tobacco products other than smoking. Again, no surprise, tobacco funding, this continues to be a concern and a cost to the state, so ongoing support of cancer and tobacco-related programs continues to be important. Specifically to the cancer programs, again, the committee felt very strongly that we need to ensure that no cuts are made to tobacco programs, and I think this slide underlines why that continues to be a priority, because our cancer incidence and mortality are still higher than surrounding states and higher than the national average in some categories.
Madam Secretary,
yes.
Are you showing slides?
Yes, can you see them?
I do not. All I see is all of you. I don't see slides.
Kiki or anyone else, do you see slides?
No.
No.
Oh, no. Let's try this again. Just looking at me, talking to myself. Thank you so much,
Well, no,
Paul.
I mean, I'm following what you said, but when you said this slide shows that, I was like,
Oh, I appreciate it. That's just the type of feedback that we need. Can folks see them now? I switched the display setting.
no.
No.
All right, well then we're gonna bag my slide presentation. And
Secretary, do you want me to show the slides?
it's so weird. So I'm clicking share. Try this one more time. And slideshow.
That's working.
Okay.
Oh, no, here we are.
Hooray! Thank you, technology. All right, well, let me just zip back through. I apologize, everyone. So again, these slides are just, this is a recap of what we had before, so it just continues to show, again, I think why the committee said it continues to be important to fund tobacco cessation and the cancer-related programs, including the Innovation Fund, which again specifically got to the youth. And this is why tobacco. We have 17,000 kids under 18 that we predict are going to die prematurely. Medicaid costs, it harms productivity. Cancer incidence and mortality continues to outpace surrounding states, although slightly better than we were doing than the prior data release, but still a long way to go. Smoking impacts heart disease. Again, cancer incidence by race and mortality. We continue to see disparities. Some of the programs under public health that we're requesting be switch funded back to the general fund that you'll see in the proposal. We continue to have children impacted by obesity, which obviously impacts long-term health outcomes, and we also see people with higher healthcare costs overall. So again, this is the previous slide around diabetes mortality and costs around diabetes and pre-diabetes. And then this specifically went to the Nurse Family Partnership Program that's funded with tobacco funds, and that the Scenario 7 proposes switch funding over to general funds. As many of you know, it's really been a core program for DHSS, specifically Division of Public Health, around infant mortality, and there's been a tremendous amount of work in this space, not the least of which includes the Nurse Family Partnership and other home visiting programs for the state. And again, this just shows the perniciously high infant mortality rate for the state, and the fact that we not only have a high infant mortality rate, but it continues to be driven by racial disparities. Again, this is the syringe service program is one of the programs that that we're proposing to keep but switch fund. And again, this just underlines the importance of this program continuing, even if it's a different funding source. We continue to have an opiate crisis, as many of you know very well. And not only does the opiate crisis drive overdose deaths, but it also increases people's risk of viral hepatitis and HIV/AIDS infections. So the needle exchange program has been a critical harm reduction program for the state around ensuring people have access to clean needles. And then also through that syringe service program, there's an opportunity to engage people around treatment. So this is, again, a census just shows the continued value of that program, that we have over 4,000 clients enrolled, including some veterans. And then this specifically goes to, I know there was a conversation around some of the programs that don't necessarily fit explicitly in the definition of the uses for the tobacco funds. Just wanted to provide some of the data that we have. No surprise, there has been a nursing shortage around COVID-19. It's been one of the hardest hit sectors, given the fact that people are showing up at acute care facilities with COVID-19, need to be treated inpatient. If also, we have many nurses in long-term care that are on the front lines of treating residents, and then they themselves are being coming down with COVID-19. World Health Organization. We didn't really have Delaware-specific data. I know Ayanna Harrison and Healthcare Commission has impaneled a workforce group to really start talking about some of these and to understand more of a Delaware perspective, but no surprise, like we are hearing not only in the United States but globally that there continues to be a nursing shortage. And so again, we expect that, you know, Delaware is no different, and we hear anecdotally from providers around the shortage. State of Delaware, specifically DHSS, we have a number of facilities that employ nurses, as well as nurses that we employ to go into home health situations, and we struggle to hire nurses. So again, with these programs and some of the conversation from the last meeting, it's not about whether these programs should continue, it's what's the appropriate funding source, and how do we have a steady realignment and a progression of moving programs off tobacco funds as the tobacco funds diminish, but finding another home or another source for the program, either somewhere in state government or with other creative partnerships. And so now the reason why I know everyone's here and why we need to be here is to vote on a recommendation of funding scenarios. Again, just to remind people where we are, we start with a reserve balance of $4.2 million. We're projecting, and as our good friend Tom Brown always says, it's not in the bank until it's in the bank, but we are projecting to have $26.5 million. We have $500,000 in interest, which leaves us with $31.2 million available. And the scenario one, which was everyone getting all of the money that they requested for FY22, leaves us with $6 million delta. And in addition to that, it completely wipes out the reserve balance. It takes the $500,000 in interest, and realizing that we are going to lose we're projected to lose an additional $4 million in tobacco funds for FY23. The conversation last time was really that wiping out the reserve fund and using the interest and using all of the payment that we're going to get in April really puts this fund in a very precarious position for future years. And these are a quick walkthrough. They have been posted for those in the public. You can see details and the specific recommendations on the HVAC website. Those have been posted for over a week, but this is a quick snapshot. And we went through a number of scenarios, none of them easy or fun, but just kind of took a number of ways to try to arrive at a number that fit within the available funds. And so where we left last time was scenario 6A. For those who were with us last time, it talked about funding all of the cancer and tobacco prevention programs at FY21 levels. It talked about preserving the social determinants of health. It talked about some switch funding and programs, keeping the reserve, preserving the reserve, preserving interest, and then to accomplish those things, it left the other programs in a position of seeing a 35% reduction from tobacco funding with a potential request for general fund. I will obviously let the committee speak for themselves, but for those who were here last time, there was a lot of concern around, again, where does that leave us, and where does that leave programs during a pandemic? And so in response to the committee and also some of the public comments that we've been receiving, as well as, again, trying to have this orderly progression of moving programs that are currently funded with tobacco funds to another funding source, we have created scenario 7. So I'm going to stop my share of this slide deck for a second and actually pull up the slides. Can folks see that? Okay, Kiki's nodding her head. Okay.
Yes.
So scenario 7, it will, when we go to the detailed slide, it will show you that anything represented by a 0, that would be, again, with the committee's approval, the request would be that anything with a 0 is switch funded to the general funds in the budget. It funded people at the FY21 levels unless their FY22 amount requested was lower than FY21, or we had 2 programs that actually received no funding in FY21, and so we used their FY22 request. We also have a little bit of, we project to have a little bit of unspent funding, about potentially $500,000 in the Delaware Prescription Assistance Program. And so to that end, we lowered the recommendation for FY22 by $500,000 to $1.5 million. And then this scenario preserves the reserve and it moves the interest to the reserve. And so if you look at the numbers, we still have our 4.25 reserve balance. We have the projected payment and the interest. And then the scenario 7 programs of switch funding and funding everyone else at the FY21 actually leaves us with some additional surplus that we could move into. It leaves us potentially with unspent money that we could move into the surplus, again, to support and blunt the impact of a $4 million drop in funds for FY23. So again, the scenario setup up at the top is the same, but you will see that for the most part, everyone is funded at the FY21 levels. There was, again, the Autism Support Program was not funded in FY21, so we used their FY22 of $500,000 for them. You see the Innovation Fund is still at the $1 million, the Healthy Communities, Social Determinants. You will see here the switch-funded programs. These are the DHSS programs that prior to the Great Recession were paid with general funds. This scenario would be a request that these programs go back and are funded by general funds in the budget at the FY21 levels to be consistent with the other programs. And let me scroll back up. And I'm sorry, Nurse Family Partnership and the behavioral health programs, those would also be requested to be paid for with general fund money. Again, the Nurse Family Partnership is that a critical way we address the infant mortality program. And so as a core service of DHSS, the request would be that it be incorporated into the DHSS budget as opposed to being on tobacco funds. And then for the behavioral health programs, those had been funded by DSAM. So the request would be that they continue to be funded by DSAM. Again, a $0 does not represent a cut. In this scenario, I would be asking the committee for their recommendation to be that these be switch funded to general funds, not cut. So with that, I want to pause and get reaction from the committee members, make sure that my presentation was clear. Paula, thank you so much for pointing out that I was talking to myself and not sharing slides. I appreciate it. Saved everyone a lot of unnecessary fluff and confusion. But yeah, I want to pause here and open it up to the committee members to ask questions or ask for clarification.
Madam Secretary, just to clarify, in your notes, it says we're funding at the FY21 level, but looking at the chart, we are funding DOJ at the 22 requests.
Yes, actually, for some reason, the 22 request is slightly smaller than the 21 request. We double checked that. It's I think 244,600, and where am I? And then it was yeah, it was, for some reason, it was a little bit higher in FY21. So we went with their FY22 request, which is $244,600.
Another question, the behavioral health programs, were they to go to, not the switch, the switch funds, were they to go to the switch funds?
Yes, sir. Yep. They would be, they have been funded by the Division of Substance Abuse and Mental Health the last few years. And so the request would be that they continue to be funded by the Division of Substance Abuse and Mental Health, and that we not move them back to, we don't want to add, it sounds like the consensus of the committee is we need to be thinking about getting programs that do not fit the core mission. We need to be migrating them off the fund. And so to put the behavioral health programs on tobacco funds would be going in the opposite direction.
Okay.
Madam Secretary, I think the scenario 7A captures all our discussions. And I think this presents to us the position where we would have something for the future reserve. And secondarily, our reserve is going to be, our payments going to be reduced by about 4 million. So this would definitely help us to move in the right directions for the future years. Only question I had is, and I don't have all my notes as ready, but based on the discussions, based on the public comments we had last time, did we capture everybody? Is there anything that we need to discuss? And I really applaud to you for the social determinants and the healthy communities and the innovations fund, because that's key for us to get to the next level. I've been attending a number of sessions and seminars, and I'm learning that SODH or social behavior determinants, they are the key for us to, especially in the COVID.
I think, Kiki, if you have other comments, as you can imagine, and as you all saw in all of the emails and the which will be posted publicly, we want to make sure that those are included in the public record. There was just tremendous concern that the committee would be suggesting a cut. And there was a restatement of just these are priorities for the state. It's very disheartening that they would be cut. And I think there was a obviously, we're going to have public comment and don't want to speak on behalf of people, but just the general summary was people very surprised that that program would be considered for a cut this year, and especially because it had not really been understood that there needed to be a cut as people were coming into this and were submitting requests for FY22. Kiki, was there any? Oh, sorry. Go ahead, Paula.
No, I was just going to say, I appreciate that, but I think my message to anybody is, you know, at some point you're going to have to expect cuts because we don't have the money, and we're going to be getting less money. And regardless of where we end up today, I would say that every agency, particularly those that aren't really within the core of the purpose of the health fund, need to start preparing for other funding scenarios, because I just don't, you know, it's not that we want to cut, but, you know, hard decisions have to be made, and we've been saying this for a long time. So I guess I would just say to those agencies, nobody wants to cut, but something's going to have to give. And whether it's, you know, I think moving things back to the general fund where they belong is certainly a good scenario, but I just think some of these agencies need to start preparing for other funding scenarios, because this is not going to be available at this level going forward. Now, you, I appreciate that you're saying rather than cutting some programs and hoping that the balance of their funding needs will be made up through the general fund, that you're suggesting we just take all the programs that were switch funded from the general fund to the tobacco fund and say, we can no longer accommodate this. It really needs to go back to the general fund, and just do sort of this clean, instead of we recommend cuts and the Joint Finance Committee has to figure out how to make it up or if to make it up. We're just going sort of, here are the programs that we can no longer afford to accommodate through the health fund.
Yes, exactly.
So break is a bad word, but it's just kind of a clean way to.
Yep. So I just pulled up on my screen where we had left with scenario 6. Preserving the cancer and tobacco prevention, social determinants, you know, moving some of the programs like the workforce development programs, having a much more significant cut between 35 and 75%, 35% reduction for tobacco to all the other programs, and really where that left, and I think in trying to be supportive and a good colleague to our friends in the General Assembly. That's just difficult, I think, from a budgetary perspective, to have so many programs that are now hybrid funded, when really the intent of the committee, if the intent of the committee is to start migrating programs off the fund, that is accomplished in a much more, I think, from a policy perspective, as well as just from a budgetary implementation perspective, that is easier to be done with this scenario 7, and really basically has almost the same budgetary impact. So it's still a request, the total dollar amount request of what is paid for with general funds versus tobacco is pretty equivalent, but again, it does it in a much cleaner and I think easier to implement fashion with this scenario 7, where it says these are the DHSS programs that were previously funded by the general fund. There's been an acknowledgement that they're core to DHSS. Let's switch fund those back to general funds.
Right.
And then to your point, Paula, really make sure that people know and are prepared and are aware that the committee identified, I'm going to go back to this 6A proposal, that there are some programs that really are a little bit outside of the legislation, like the workforce development programs, that potentially is a stretch program. It's a little bit of a leap and fits into that sort of and other health things,
right.
as opposed to being
Right.
rolled out like tobacco and cancer programs are. Again, public access defibrillation program, there's just a number of programs that, again, kind of fall into that bucket of and other funding. But this scenario 7 puts people on notice that we need to start making some significant changes to how we're funding these programs, but doesn't, I guess, spring cuts on people or potentially spring switch fund on the General Assembly in a way that's going to be complicated to implement.
Right.
So
Now,
again,
I appreciate that. And if this is the way we just decide to go, I think I would just want to make it really clear, particularly to those stretch programs, that they really shouldn't count on full funding next year if we're going to stick to our core.
And if I was going to try to pull up the programs that we identified as stretch, just so that people understand what we're
that's a good point.
We're discussing. So again, what was identified as a stretch program, the Delaware Network for Excellence in Autism program, which is identified here as the autism support, the AIDS Delaware, the nursing programs identified under workforce development. I guess I apologize, the paramedic program should have also been listed as a 0. And then the Easter Seals respite program, as well as the Ecumenical Council caregiver program. Again, those were identified not as programs that don't have value or they don't provide support or necessary assistance to Delawareans, but they really don't cleanly fit under the statutory requirements for healthcare or Health Fund Advisory Committee spending.
And I think I said last time, and I'll say again, workforce development, I think, is one of the most important public policy issues for government to pursue. I question whether this is the vehicle for pursuing it. So.
For providing the funding for it. Not for pursuing.
Yes, exactly.
Madam Secretary, based on everything that we heard and based on looking at what we did last year, I believe I'm looking at the comparatives, and I think we are really dealing with the situations about the same way in terms of the switch fund and some of the funding it from the general fund. Secondarily, what this does for us is it prepares us for the future, because as we know, the dollars coming in is going to be depleted. And secondarily, also gives a little bit of the preparations for those agencies that has to plan, and this gives them the time to adjust their budgets going forward. Every dollar that is being lost out of it for anybody is a loss, and nobody wants to be at a short end. At the same token, I believe this is going to make the pain easier for all of us to swallow as we go into the next year and the future years, because future years are not going to be able to afford us to continue this process going on. So I applaud for you putting this together, and I think this makes everybody at the base level that we all could build on.
Great. Are there any other questions or feedback from committee members?
So, Madam Secretary, I know we haven't approved this yet, but I am fully supportive of this new scenario. I think it does everything we want to do, including my concern about getting the reserve built up a little bit in anticipation of next year. I've long been a proponent that we make our recommendations face to face, because I think it's critical that that everyone knows the reasons why we made the decisions. Unfortunately, we haven't been able to do that in the past, and in a pandemic scenario, we're not going to be able to do it this year. But I think it's critical that you articulate in your response, showing our recommendations, that you explain it very clearly the reasons why we made these decisions, so that it's understandable about the movement for the switch programs. Again, that the committee is not in any way suggesting that any of these programs are not worthy and necessary, but that we have to move away from funding from HVAC to some other source in order to preserve our fund moving forward. I think it's critical that you mentioned about the potential $4 million reduction next year. Not potential. I think it's a reality. So I think it's important that we recognize that, and to emphasize the success that the Innovative Fund had in its first year, and that the potential it has moving forward. So I think all those things are critical for you to articulate in your response with our recommendations. Not just say, okay, here are the recommendations are, but the reasons behind it.
Right.
And to Paula's earlier point, and I say this pretty much every year, if we do our job the way we're supposed to, this fund is going to continually go down, and rightly so, because that means people are smoking less cigarettes, and that's the end game right there. But I think it's important that we make note to all our fund recipients that they have to begin planning now for potential reductions in next year and beyond. So I think Paula's point about putting fund receivers on notice is also an important thing as well.
I agree, and I think
I would like to add that we've made these kind of statements almost every year, and the challenges remain. So, and they're becoming, I think, more acute as we move ahead. And when we look at the original legislation, which was signed on July 20th, 1999, the Senate Bill 8, those purposes, they have a lot of wiggle room in them. So I think we have to be careful about saying things are stretch funds. I mean, I guess I would agree there are things that are a stretch in there, but they don't really go against what the purpose of that legislation was.
Secretary, I just had one quick question.
Sure.
In terms of the innovation fund and the mechanics thereof, I am sure you must have the process that you are going to share with the peoples on the call, and secondarily in the social determinants. Is any of these mechanics that we have thought through it, like what we did last year? Is there anything that you need anybody to be participating? So I just wanted the general public to understand that those two million each would have the process in place.
Yes, and I have to pull up, I think it's in our first presentation that Don and then also Lisa Henry from Public Health walked through how those funds have been spent. Let's see if I have it.
Yeah, we did that at the first meeting.
That's what I'm gonna go see if I can quick pull up my meeting minutes. Goodness gracious, 63 pages of slides.
Madam Secretary, I know it is too much to look it up. Don't worry about it. I think I met with Lisa and we had the picking of the 4 or 5, whatever, and I think we moved forward with that. I just wanted to make sure the general public either has the ability to see it or has the ability to know about it. Because there are some small opportunities that somebody who has been deeply hurt and wants to come out. I think the intent of the innovation is to see if there is a way we could solve the old problems with the newer technological way, if there is a way we could do so.
Yes, yep, absolutely. So here's, actually I was able to find it. So we will have, and I think to your point, we absolutely need to make sure that people who typically attend these meetings are aware of the funding opportunities in addition to the general public around when applications are available for the innovation funds. And yep, and then we will obviously continue on a yearly basis to make sure that it is part of our meetings to come back and say, this is how the funding was actually spent. So application period, and then again, this is ultimately what the programs were, what programs were funded and what they actually did. So yeah, so here we go. So proposed priorities, again, like we said, vaping prevention, focus on housing access, and then the school health, the physical activity, asthma, vision, mental health, increasing dental access, and then obesity and physical activity, which unfortunately we're watching and worried are going to get worse, given that a lot of kids still aren't in school because of the pandemic, and there's not as many extracurricular activities offered to children due to COVID restrictions around sports and what people can play and the manner in which sports are even played. So I do think, again, these do continue to be priorities, and we do need to continue to think creatively, which is why the Innovation Fund and the ability to accept applications and go after these priorities through the Innovation Fund continues to be very important to the state. And unfortunately, the pandemic is showing us why, even more why these need to be our focus areas.
Madam Secretary, I was intrigued. I read each one of those applications that we had, and they were probably, seems like there were about 100 of them. So it was really, really interesting. Lisa and I spent the time to forward it to Don to make his final play, so to speak, but it was intriguing. So many people came with so many wonderful ideas with what's going on, and it was really, really eye-opening. And I think that's what we want to. We want to create people's creativity, and maybe we could solve some of the problems maybe a little differently.
Here,
Thank
here.
you.
Amen.
Okay, is there any other comments or questions or concerns? I will go back to scenario 7. Again, here's the top line view. So it would put us in the position of going into FY23, assuming nothing changes with the 26.5 that we receive, would put us in a position of being able to blunt some of the impacts of a $4 million drop for FY23. But sadly would still put us in a position again when we meet again next year of having some tough conversations around what's funded with tobacco funds and where programs get funded that don't fit within the available funding.
Mm-hmm. We say this every year, and then we get these applications every year. So I just hope people really take to heart what we're saying about that. And then if we accept this, and it looks like we've got about $2 million that we haven't addressed, but I would think the most reasonable thing would be to put it into the reserve. And if it goes anywhere else, I would say the innovation fund, or at least split the difference or something like that.
Yep, so this proposal as currently written would be to allocate any funds, so to fund everybody at FY21, because the challenge is when you get into FY22, you quickly exceed the $2 million difference between, you eat up the almost $2.5 million difference between what we expect the payment to be and this figure right here. So holding everybody at FY21 and then providing availability for not the two programs that were not funded in FY21 to come in for FY22, again, leaves us with a bit of a cushion going into FY23, where we will see it will not be $26.5 million. It'll likely be $22.5 million.
Right.
But obviously happy to consider a different recommendation.
I'm happy with this one.
Likewise.
Yeah,
Yeah.
I think this is a reasonable, if
Okay, does someone want to make a motion that this be the recommendation for FY22 for the Health Fund Advisory Committee?
Yeah, I make a motion that we approve the scenario 7.
A second.
Second,
and then let's just be clear, the extra money is going into the reserve.
Yep, we'll make that change. Interest, actually, I'll do this, move interest, additional funding to the reserve.
Perfect.
Do this really quickly so Steve doesn't come back and say, "What'd you do?" Okay.
Madam Secretary, as we are approving the scenario 7, we do not need to go into details of the switch fund and all the other information. Is that correct? And you would be final drafting the proposal, and as you send it to the JFC, everybody would get a copy of your final verdict, correct?
Yes, absolutely. So that's why I tried to articulate up top here,
Right.
you know, which funded programs are represented by the $0. It's the FY22 budget. If there's any other, again, for transparency purposes, if there's any other bullet points or you want me to edit, and also to be clear to the public, we are in the discussion portion of the motion. Because we have a motion and a second, but we're in the period of discussion on the motion. Is there anything else that folks would like me to add to this to clarify the intent of the motion?
Secretary, there is a request from the public. If you could scroll through the scenario one more time, just so everyone understands what's being voted on in the public.
Absolutely. So we'll walk through with the cancer programs. They are funded at the FY21 budget level, which is different than the FY22 request in a number of scenarios. The Brandywine Counseling Smoking Cessation Program did not have an FY21 budget allotment or appropriation, and they requested this amount, $52.4, for FY22, which is why the scenario 7 recommendation is for $52.4. For the disability programs, the Medicaid SSI actually requested less money for fiscal year 22 than they did for 21, so that's why that recommendation is different. But the remaining 3 programs all mirror their FY21 funding levels. Tobacco prevention, again, Department of Justice actually requested slightly lower money for FY22. Thank you, our DOJ friends. The remaining programs are proposed to be funded at their FY21 levels. Delaware Prescription Assistance Program again we anticipate them having about $500,000 left over at the end of FY21. So we have had a similar reduction from $2 million to $1.5 million. So it would not be them losing funding, it's just we anticipate them having additional funding. The workforce programs again are at the FY21 level. Behavioral health programs are proposed to stay on the DSAM budget, so continue to be funded with general fund dollars. Nurse Family Partnership, that would be a new switch fund request to move to the Division of Public Health's budget. Other programs are at the FY21 levels. Oop, actually, I take that back. I just realized there must be a delta somewhere because I have a different FY21 amount.
Mhm.
You had the 500 for the autism.
Thank you. I was like, I know there's a reason we did. Thank you. So the autism program did not have an FY21 allocation due to carryover funds from previous years. We heard very clearly those funds have been exhausted. They have no additional funding. So that's why the recommendation is $500,000 based on their FY22 request. Again, the Innovation Fund, the Healthy Communities, those all stay at the FY21 level. And then these switch funded programs, these had previously been on the DHSS budget, and the request is for them to go back to the DHSS general fund budget. So that leaves us with a request, $24,055,060, which would leave us with $7.2 million that would then move and become the reserve balance for and the starting point for FY23. And again, we anticipate that the FY23 payment is actually going to be $22.5 million, so $4 million less than we project having for FY22. Okay, so we have a motion, a second. Is there any other discussion or questions? Okay, all in favor?
Aye.
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 Is anyone opposed or abstaining? Okay, wonderful. Thank you all so much. The recommendation passes for scenario 7. Again, we'll make sure that everyone sees the recommendation before it's submitted to the Joint Finance Committee, and we will also publicly post that. And with that, Kiki, we will move to public comments. Those who do want to, no, I messed up. I like one instruction from Kiki to request that people who want to ask questions or give comment put their names in the chat. So I apologize if you have not already done that and would like to make a public comment. Please do that now. And I think, Kiki, based on the number of people who had contacted us in advance, we may need to limit comment to 2 minutes just to ensure that we have enough time to hear from everyone.
Sure, I have a list of 6 people so far. If there's anyone else who would like to speak, please just note in the chat box and I'll add you to the list. First up, I have Sarah Busick from the Delaware PTA. And Sarah, you should be able to unmute yourself.
Yes, thank you. I just did. So thank you, Secretary McGarrick. I think you explained that, this was not about the value of programs, and Delaware PTA understands that. But I just wanted to, for the record, explain our position on the school-based wellness centers. My name is Sarah Bucic. I'm with Delaware PTA, and Delaware PTA actually has advocated for the school-based wellness centers long before COVID. And we know the value to our students with these centers. And Delaware PTA, National PTA believe that these centers are necessary, especially for our most vulnerable populations who often do not have access to general practitioners and other healthcare providers. And while these wellness centers are really great for, getting on-site sports evaluations and on-site healthcare, we know that they are critical for students who are in poverty and who receive wraparound services. And we know those wraparound services are integral to students learning, because if students aren't healthy, they can't learn. So we know they're really important for our youngest children, especially with the newest elementary school-based wellness centers. And we're really happy that the tobacco funds are decreasing, of course, because that means less people are smoking. But we don't want to see this reduction in tobacco funding lead to the elimination of our centers here. And so we would really like them to not, the school-based wellness centers to not be a pass-through cost. The COVID-19 has underscored the importance of these centers, and we'd really like to see a permanent funding solution as part of the budget for our school-based wellness centers. And I know you guys mentioned that today, that you are going to be recommending that these centers and these other programs look for alternate funding, but we would really like to see permanent funding for these centers. Thank you.
Thank you.
Thank you, Sarah. And up next, there is Erin Miller, who's a school nurse in the Colonial School District. Erin, you should be able to speak and unmute yourself.
Can you hear me? Can you guys hear me?
Yeah.
Yes.
Hi, my name is Erin Miller. I'm one of the school nurses at William Penn. I was speaking on behalf of my colleagues concerning the school-based wellness center as well and the services they provide. For all of you that are not familiar with William Penn, I'll just give you a snippet of our information. We are the largest school in the state of Delaware. We currently have 2,316 students and families. The percentage of low-income families that we currently deal with are 33.89%, homeless is 1.13%, and we have approximately 0.49% in foster care. There is a significant correlation between poverty and healthcare outcomes, according to the Healthy People of 2020. Residents of impoverished neighborhoods and communities are at an increased risk for mental illnesses, chronic diseases, higher mortality, and low life expectancy. Equally important to poverty, the majority of students throughout the district are African American or Black descent, which, as we learned in COVID-19, longstanding systemic health and social inequities have put many people from racial and ethnic backgrounds at an increase for getting sick and dying. Henceforth, the urgency for a school-based wellness center to continue to provide easy access to quality healthcare services for students and families. As you know, student services provided by the school-based wellness center include physicals, sports physicals, immunizations, minor injury and illness treatments, reproductive health, prescriptions, nutrition counseling, and individual counseling, all of which are very important. These essential services are essential for health maintenance and to meet the needs of our students. The William Penn nurses and healthcare centers are committed to doing a collaborative partnership. We work diligently with a nurse practitioner who happens to be Teresa Tran to ensure students are up to date on vaccinations, physicals, allowing students to remain healthy in the school so they can have the best access to doing their work in school. The nurses make countless referrals to the Wellness Center for evaluation of students' physical and mental health. The convenience and no-cost services are invaluable to our students and families. Let's face it, there are many barriers to families accessing healthcare, like cost of care, lack of transportation, language barriers, or the families simply are petrified to see a local provider due to their immigration status. And a wellness center positioned inside the school setting eliminates that strain on the families. If the healthcare center was not available or offered reduced services, then it would have a detrimental effect on the students, families, and community at large, particularly now when families are already experiencing dire hardships. With that said, we want to praise to our current healthcare center staff who are still continuing to provide essential care during the pandemic. And in closing, we believe all students should have equal opportunities to pursue a healthy lifestyle. We are confident that the collaboration of the nurses in the schools along with the wellness centers provide a safe space for families to receive compassionate care and education. Thank you for your time and active listening.
Thank you.
Thank you.
Next up, we have Tony Windsor from the Boys and Girls Club of Delaware. And Tony, you can unmute yourself.
Okay, well, thank you so much for allowing me to speak. First of all, I would like to say how much of an educational experience this has been. I think this is a great opportunity to learn about the things that you have to deal with when it comes to pulling together budgets to help so many different agencies in the state. And I'd like to use this time, and I will promise to keep it brief, but I'd like to use this time not only to share how important the public health and ALA mini grant funding has been to our organization for so many years, but also just to use this as an opportunity to say thank you. Thank you so much to you all for the hard work and how much you put into making sure that there's a diversified outreach of funds to help so many different people, so many different segments of our society. So on behalf of Boys and Girls Clubs, I just want to say that we just appreciate so much American Lung Association and public health. We appreciate the professional, effective, and efficient manner in which the ALA has administered this program over the years, and the thousands of young people at Boys and Girls Clubs in communities throughout Delaware who have benefited from literally life-changing tobacco prevention information. As a youth development organization, we obviously sorely need resources to help our young people and their families have access to positive youth development and healthy lifestyle programming and activities. And we really appreciate having an agency as dependable and cooperative as the ALA and public health as a partner in our mission to support the healthy lifestyles of our young people and their families. I just want to say the ALA and its staff have been a superb partner, provide valuable assistance, and make themselves available whenever our participating club sites have questions or other needs. And I would just like, if you could bear with me just for about a minute and a half, I'd like to just share 3 of the typically 6 sites that receive funding each year at Boys and Girls Clubs. Wanted to share a few comments about how valuable the funding has been to support their programming. The Georgetown Boys and Girls Club, under the direction of Renee Hickman, writes, the greatest impact we would face in losing funding would be the extent of education that we are able to provide to the children and their parents. We have embraced the component of the grant that deals with physical exercise and nutrition, and it helps us focus on health and nutrition. It would be an extreme loss for our children if that information is not able to be shared because of a funding loss. We have embraced the program by providing healthy recipes for the children and having a cooking class that demonstrates how easy it is to eat healthy. When we were closed for COVID-19, we utilized a virtual platform to get that program out to the parents. I fear that if we have to go through another shutdown in the future and that funding is not available, we would see an enormous increase in the amount of children that are overweight. We were able to provide fitness activities for the families to do together and material to learn about healthy eating and diet. I also look at the tobacco prevention piece that would be greatly missed if the funding were to stop. As we reflect on all the crises that families have been facing during the year, I'm sure more of them have turned to smoking and other harmful drugs because of their frustration. If we are not there to provide the education needed to help them make better choices, not only will they be affected, but there will be a grave effect on our children. And I recognize, having listened to the comments from the panel, that what is being stressed in that is not necessarily something that is really, you all are doing wonderfully trying to make sure funding lasts, but we always know that it can't be a forever flowing river. So we do want to keep that in mind, but we do want you to know how valuable it is. Renee said the 2 programs that we utilize the funding for go hand in hand, and we do not have enough resources to be able to handle them without that funding. I also reflect on the community event that we partner with.
I apologize, and we thank you so much for your partnership.
Okay, I'm sorry.
And
Okay.
we appreciate the enthusiasm and just also what you all have done to stay open and support children and families during the pandemic. But I just want to make sure we have time to get to
absolutely. And I just you get my drift. Thank you so much for all your support, and we appreciate it very much.
We appreciate you all. Thank you.
Next up is Christina Bryan from the Delaware Healthcare Association. We found her. Christina, you can unmute yourself.
Thanks, Kiki. I just wanted to say thank you to Secretary McGarrick and members of the committee for your vote for scenario 7 to switch fund school-based health centers in particular back to the general fund. On behalf of Delaware's hospitals and healthcare delivery systems, our hospitals are providers of medical sponsors of school-based health centers, 31 of the 32 high school centers. So they're vitally important to the health, mental health, and safety of our students and keeping them in school. So really appreciate that vote. And that was one of our requests. Of course, we don't want to see it cut. And we look forward to working with you, Secretary, and members of the JFC, of course, when it comes time to advocate for funding of school-based health centers to the general fund. So thank you very much.
Thank you.
Thanks, Christina. And The last person I have on the list is Erin Goldner, a volunteer with Families in Wilmington. If there's anyone else who would like to speak, please comment now, or that's the entire list that I have. And Erin, you can unmute yourself.
Okay, thank you very much. My name's Erin Goldner. I actually do work with the Boys and Girls Club too. Girls on the Run, which is a recreational activity for girls, teaching them about how to be healthy and exercise. And we have had girls in the past that their weight actually interfered with their ability to run. But we work with what we have, and Boys and Girls Club does a great job. What I noticed or observed in the financials, the numbers, the health disparities, and the funding for the centers, the health centers. Part of the disparity is can't get to the center. Part of this disparity is that there's not enough centers in Wilmington, let alone outside of Wilmington, where somebody has to drive to receive the service. So an idea or an input that I have is to increase the amount of money that goes to health disparities. And I know that the secretary was saying a lot of money is intertwined, and you try to figure out how the funding, you can get the whole funding by intertwining other amounts, but we do have huge health disparities. And the discussion previous was that a lot of those disparities affect people's health. I mean, I go into homes where there's constant smoking of cigarettes in the home, babies, children under the age of 18. That's their normal. We have to have innovative centers that provide the health and have this wonderful nurse or doctor, but they can only serve so many people. And if you have a large school that is 18-minute drive, hour and a half bus ride or more, trying to serve all these children with all these different needs, it's perturbing. And if you have funding that can fund something on the east side of Wilmington and coordinate with the state service centers and increase the amount of money that goes to health disparities, because we've had enough studies from the University of Delaware to show us where those are. Not everybody has a great presentation for these committees to tell you all their needs, but there are enough facts and enough evidence to show that the health disparities needs to be increased. And I know you're talking about having a reserve, but we are losing people. People are not the healthiest they could be. And I think it's great we have, healthcare in schools, but my kids don't always make it to school, or my kids are in alternative programs, and my kids can't get to school, or my kids miss the bus. And now we're in COVID, so my kids aren't at the school or anywhere near there. We have to have the centers focused where the disparities are. If you're funding things that sound great and nice and happy, it makes people like me really upset. But thank you. And I just saw those numbers, and I think that the monies needs to go toward the disparities. And then if the disparities decide that the monies go to the school, that would make sense, or school-based things. But you got to look at the facts and the evidence. Thank you.
Thank you, Erin. Hey, Kiki, is there anyone else?
I don't see anyone else has signed up. If I'm mistaken, please comment quickly or raise your hand. Otherwise, that's all I have.
Okay. Well, thank you, everyone. And again, we did receive emails and comments via email, so we will ensure that those comments are posted along with all of the other meeting materials and minutes, so that they are part of the public record for this conversation. And obviously, all of those comments will be important. As we say frequently, this committee does a lot of great work, and we have wonderful people on it. But the work done here is a recommendation to the Joint Finance Committee and to the governor as he puts his budget together. So as much as we would love to say the work is done and we have a solution, we are only part of the way there, and we need to see where not only the governor's budget ends up, but as well as the will of the General Assembly. And we know that there's a lot in flux this year as we continue to move through a pandemic. So it's have another DFAC meeting in December that'll give us an additional look into not only where we're ending FY22 and potentially any new money or losses of funds, but as well as what the revenue picture looks like for FY22 above and beyond the tobacco. So our work is not done. Is there anything else that the committee would like to discuss or put on the record before we adjourn today?
Madam Secretary, I don't think it needs to be reiterated, but I will. And that is when you do craft your response to the governor and the JFC, that you be mindful about explaining as succinctly as you can the reasons for our decisions. I think that's an important part of our presentation, not just that we're pushing off the Swiss funded programs to the General Assembly, but the reasons behind it. And the explanation about DPAP, for example, we're reducing funding by $500,000, but there's reasons behind it. So I think it's really, really important that that your cover letter kind of goes into some detail in terms of the discussion that took place during these meetings and the work that was put in by the committee members.
Amen.
Absolutely.
Agreed.
And I
Madam
will speak
Secretary,
but people are welcome during the DHSS presentation. There's always an to JFC, that is, there's always the opportunity for public comment. And so maybe since it is difficult, and we know that JFC has a lot on their plate when they have these budget hearings. And so I know, to your point, Don, it has been requested that HVAC have a built-in opportunity, and that's just been difficult to honor given the schedule. But perhaps it makes sense, in addition to what's in my presentation, to have another member. Not gonna point fingers, but maybe Don would be good, but have somebody actually give a public comment that can also make sure it's part of the record of our JFC hearing, some of the deliberations of the committee.
Madam
Secretary, to make
Secretary,
your
I'd like
job
to
easier.
thank you. Excuse me, go ahead.
You go ahead, Dr. Reinhardt.
I just wanted to thank Madam Secretary and her team for the excellent preparation for these meetings. It certainly makes our job as members of the committee easier, and thank you.
Thank you for acknowledging. We have Kiki Evinger, who does a lot. Behind the scenes is also Jules Emery, Carrie Anderson, and Christine Dolan from the budget team. So appreciate you acknowledging their hard work.
Yeah, good job.
Madam Secretary, everything you said is good, but if there is anything with your hard work, I'll be more than happy to volunteer myself if you need somebody to be joining with Don, because he has a lot more history and he has a lot more charisma than I have. So I would love to join if there is a need for it.
Absolutely. Well, and again, I will make sure that the committee has an opportunity to see and ensure that the materials that go to JFC accurately reflect the recommendations and the work. So happy to share that draft before it goes, again, to ensure that we're consistent with the public discussion and the public record and all the deliberations that took place.
Thank you again.
Thank you.
Okay.
I
Anyone
move
else?
for adjournment.
I second that.
Okay, all in favor?
Aye.
Hi.
Thank you all so much for your incredible work and dedication. None of you are paid, and I know you all are extremely busy and have lots of other ways to spend your time. So on behalf of the department and all of the people that benefit from these funds, thank you for your willingness to serve and to be part of this important process, especially for many of you from the inception of this work. So on behalf of all of us at DHSS, thank you so much.
Thank you again. For
You're
all the
welcome.
hard work.
Thank you. Thank you, Madam Secretary.
And thank you to the public. We appreciate you all being here as well.
Bye-bye.
Aye.
Bye.